Hi, that's a video to show you some updates that will be available from version 9.3.0.3230. So what I would like to start with is our deregistration feature that we saw before. What changed is, as you would remember before, there was just this small sign showing up with broken item sign telling that they're registered, but now also there is a new item to say that that patient has been registered and the reason for that and the date that happened, so the registration will be much more tidy. So again, to access the registration option, you have to open the patient first, go to HCR, and then you click CDM, the registration. It won't work here because this patient is not registered anywhere, but then you'll get a prompt to ask you for a reason for that. And again, to show you the different icons, so this broken icon of item that tells you that this condition has been registered, but also there is new item that tells you that patient moved practice, and that's the reason for the registration. Now, the next thing that I've heard is causing problems in some practices is the new way that CDM is acting when it's activated. So if I create a new transaction and I click on CDM, what you notice first is it's calling out to PCRS. That did not happen before, but now anytime you open CDM MediForm, it calls out to PCRS. The reason for that is to avoid situations when the patient, especially if they moved, that they had a recent CDM that HealthOne is not aware of, so you have not performed work, that then you tear your hair out, why was I not paid for the work that I did? So that will alert you that way that no, this patient actually had reviewed, they're not due for CDM as yet. Now, the second order consequence of introducing that is that you have to have, one, your PCRS certificate installed for the GMS list that patient belongs to, and B, you have to have active password. We probably all remember from old cycle of care for diabetes that we had this icon here to check for active and working connection to PCRS, and that's where you can change your password, right? So as you can see here, we have login for our practice, meaning this login allows to access all GMS lists from partners, and that works grand. The problem might appear for practices who are having one server, multiple doctors that are technically not in partnership, and they keep separate PCR certificates and logins, because at the moment you can hold only one login. We're trying to find solution for that, but at the moment you just have to log out, change the settings, log in. Another new feature are new templates. So I will put a link to the templates that I created, and I think they're reasonably good, in the description on this video and together in the email. But effectively what I mean by new templates is it will pull the date, right? So if your problem has a start date, this date will be pulled here. If you happened to code your condition with your ICD or ICPC, it will pull out as well. For repeat medications, it will pull date last prescribed. So if you happened to have a legacy medication that was last used 5 years ago, that will have the old date, so that will alert receiving party that either patient is non-compliant or you just forgot to stop it. And then it will also pull the date and type of reaction, both for true allergy and for what you coded as adverse reaction if you stop the drug. So the receiving party were aware of what actually happened when you tried to give this drug to the patient. So that's the layout of that. The signature will be populated automatically. That will be shared if you decide you want to use it. It will also go to your HealthLink referrals, those dates and types of reactions, right? So when you open your HealthLink MediForm, and I'm reminding that you can now just press this button to open the window for referrals, or the shortcut is Ctrl F8. So if we scroll down, you can see that type of reaction has auto-populated here for those drugs. The dates didn't. We have to fix that. Another feature introduced is encrypting PDFs. For the moment, it will work only if you are exporting X amount of transactions from the site. It does not work for templates yet. The work is in progress. You have first to activate it, so you have to go to Tools, Options, Internet, Email PDF Encryption. At the moment you have only two options, either no encryption or password protected by date of birth. Date of birth will be in format day, month, year. So that's 8-digit without any commas or slashes. So if I decided to send this out, send through direct email, I have this option now. So when I send it out to presumably the patient, if their email gets compromised and their PDFs are leaked, they are kind of protected. It's easy enough password, meaning it's patient's date of birth, but it adds a bit of friction nonetheless. Next small thing that was changed is your Alliance referral for imaging. It's called version 2 at the moment. It auto-populates most of things, as you can see, including phone number, email if exists. You have to hand select what you're looking for, and for CTs, and I believe particularly CTs with contrast, it will auto-populate the last EGFR from the file as well. So that's one thing less for you to look for when you're doing the referral. Next small thing is COVID MediForm. So on this live example, you can see that patients received quite a few of COVID jabs. Now, apparently, for some reason, the COVAX is flooded with incorrect submissions, as patient had primary, meaning first ever COVID vaccines, and out of sudden they are coded again as receiving primary, which is incorrect. They're quite resistant to accept the probably best solution, meaning bidirectional communication, that we can actively in the background check how many vaccines patient got and automatically select the correct phrasing. So we have a tiny bit of help in MediForm designed. So when you select your COVID vaccine and you go forward, you can see the design of which dose you're giving has changed a bit. So the MediForm will automatically look back and see if the patient received the 2 vaccinations initially. And if they did, it will make this primary course inactive, because effectively you're giving a booster, and it will pre-select it. So again, less clicking, a small improvement, but hopefully useful. Now the last thing I would like to remind you about is the CDM Finder. So you get it through Analysis and Chronic Disease Management Finder. It works kind of well for certain things. For heart failure, it's currently useless. Number one, because heart failure is not CDM condition. Number two, because in the spec that Clanwilliam received, HSE wanted to put everybody who has ischemic heart disease and heart failure to heart failure category, which is factually incorrect. Now, the developers did not want to change that with only my feedback. So if you agree with me that this is stupid, please email them and tell them that this is not fit for purpose. Another use less effectively because of too many false positives ideas that the spec had is that any patient who ever got topical steroid is a possible case of asthma, which is flooding the asthma finder, otherwise useful tool, with many false positives. So if you agree that that's overkill as well, please do email Clanwilliam and tell them that no, that's not worth doing. In terms of atrial fibrillation and type 2 diabetes finder, they're quite good. We went actually in my practice through atrial fibrillation finder, and we were able to identify some patients who either just went through the cracks and we did not pick them up and register them, and also we identified a few patients that we were doing the work but they were not coded properly, so we were paid for 1 or 2 conditions for their ischemic heart disease but not for their AFibs. So worthwhile sitting with your practice manager and going through those to make sure you maximize your revenue. Now the last thing, not strictly related to health fund development as such, that's MediForm I did for GLP1s. I think it's potentially quite useful. It has both phase 1 initiation, phase 2 continuation. For initiation, it will in the background check a lot of those things, but it will start working more magic when you put actually their weight, right? So that's what triggers certain checks and pick up the drug. Because some warnings are for specific drugs only. If you pick then your medication and you set up your follow-up period, if you click on print patient information leaflet, it will put your practice details here. It will put all the information what you put in as titration to patient information as well. You can obviously give me feedback. You can edit as you find it fit for your purposes. The phase 2 will automatically calculate the weight change and suggest what to do. So if percent change was 0, it suggests to stop treatment. If percent change is over 5%, it automatically suggests to continue treatment. And you have different regimes for different drugs that you can have a sneaky peek at if you decide to just copy paste to your prescription. That's the end of this video. Thank you.